A promise, I'm back. Good evening once again. Welcome to today's video where we are going to be looking about the oral cavity. But if it's your very first time to watching, please make sure you subscribe. You put on the notification bell so that whenever I load the video, you are the very first person to watch. So let's go ahead and get started and look at what we call the oral cavity study. Okay. And during the study of the oral cavity, we are going to be looking at the anatomy of the oral cavity and then some other structures which are just going to be next to the oral cavity. We shall look about what we call the tongue, because the tongue is going to be one of the most important structures in the digestive system, which is going to be part of what we call the accessory. And then we shall also talk about the teeth, which is also a very important part of the accessory digestive structures. And even also we shall talk about what we call the pharynx, which is also going to be part of what we call the alimentary canal. Okay, so now let's go ahead and get started and look at what we call the anatomy of the oral cavity. Okay, now starting from this diagrammatic illustration, it is showing most of the areas within the oral cavity and other areas that are just next to the oral cavity. Okay, so now starting with this area here, this one here are what we call the lips. Okay, they are what we call the lips. We have what we call the upper lip, and even also we have what we call the lower lips. Okay, and then of course just between the lips we have what we call the vestibule. Okay, we have what we call the oral vestibule. Okay, so now these are the upper lip, the lower lip. Okay, now when we come inside here, we see this kind of green-like structure. This one here, this one is going to be the teeth. Okay, it's going to be the teeth, of course, because this is going to be now the anterior part is going to be mainly what we call the incisors. Okay, and then we have at the roof of this kind of the oral cavity, at the roof we have this structure here. We have the one which is a bit bony, and then there's another one which is going to be a bit more muscular. Okay, now this one here, which is very anteriorly at the roof of the oral cavity, you know how this one is called? This one is what we call the hard palate. Okay, and the hard palate is super very important. It's going to be differentiating between the oral cavity and then the nasal cavity, because up here we have what we call the nasal cavity, and then here we have what we call the oral cavity. So now this structure which is going to be differentiating between the two cavities is what we call the hard palate, and besides that is going to be creating the roof of the oral cavity. Okay, and of course because of that is also going to be aiding the tongue is going to be pushing food against this kind of the hard palate in the process of what we call the chewing. Okay, and then posteriorly, just next to what we call the hard palate, you have this structure which is going to be having a lot of the muscles, which we call the soft palate. Okay, and of course the soft palate is going to be very important in a way that during swallowing process, it's going to be moving up to close what we call the nasopharynx, such that to stop food from flushing into what we call the nasal cavity. Okay, it is such another beautiful thing. Okay. Now, at the back of what we call the soft palate, we have this kind of the structure which looks like a finger-like structure. You know how this structure is called? It's like a drop-like structure. It is what we call the uvula. Okay, super very important. When swallowing, it moves up such that nothing flushes back in the oral cavity. Okay. Then when we come to this structure, this red-like structure, very important muscular organ, part of what we call the accessory digestive structure. You know how this structure is called? This structure here is what we call the tongue. Okay, is what we call the tongue. We shall get in detail and look about all the structures that are going to be part of what we call the tongue later. Okay, then this one is going to be now the mandible. Okay, it's going to be the mandible, and of course we're going to be having the teeth coming off from the mandible, because this is what called the adherent part that's going to be supporting the teeth. Okay. Then when we come at the base of the tongue, we are going to be having this kind of the lymphoid tissue. You know how this kind of the lymphoid tissue are called? This kind of the lymphoid tissue are what we call the lingotonsils. Okay, the lingotonsils, and then even also have what we call here, what we call the palatine tonsils. These structures are very important in the way that they are going to be what we call the primary immunity, what we call the oral cavity. They are going to be trapping some kind of the microorganisms that are going to be coming off is what we call food. Sometimes when these kind of the lymphoid tissues are damaged or are infected, we always experience pain when we are swallowing. Okay, and that condition is what we call the tonsillitis. It means these kind of the lymphoid tissues, they are just inflamed. Okay. And then when you come on this kind of the palatine tonsils, just anterior to it, we have what we call the palatoglossal arch. Okay, we have what we call the palatoglossal arch, and then just behind it we have what we call the palatopharyngeal arch. We shall look at these arches whenever we are studying about the deglutition process, such that because when food reaches this area, it stimulates what we call a swallowing process. We shall look at that one later during the study of the deglutition process. Okay. And then when we come this side here, we also have another kind of the lymphoid tissue. This kind of the lymphoid tissue is what we call the pharyngeal tonsils. Okay, pharyngeal tonsils, they're going to be trapping any kind of the microbes that maybe could be coming with what we call air. Another name of the pharyngeal tonsils, you may find some people calling it the adenoids. Okay, so now if this kind of the adenoids gets infected, they can lead to a condition which you call adenitis. Okay, it's such another beautiful thing. Okay. Now, in the nasal cavity, you're going to be having a lot of the nasal conchas, the superior, the middle, the inferior, that are going to be making sure that the air which is filtered very well before it comes into what we call the trachea. So now the whole of this structure is going to be the nasal cavity. And then you have this hollow structure within the frontal bone, what we call the frontal sinus. Super very important in reducing the weight of the skull. Then we also have what we call this structure here, what we call the ethmoid bone, having very many holes that are going to be allowing the epithelium, what we call the olfactory nerve. Okay, and of course this is the area where you're going to be having the odor particles being sensed, and then the information is taken to the central nervous system through what we call the olfactory nerve, which is called nerve number 1. Super beautiful. Okay. And then when we come at the back here, we have this bone structure. You know how this bone is called? This bone is what we call the sphenoid bone. And of course, this sphenoid bone is going to be having another sinus inside here, which we call the sphenoid sinus. Okay? And then we have also this kind of small invagination. You know how this invagination is called? This invagination is what we call the sella tachyca. And of course, this is the area which is going to be housing what we call the pituitary gland. It can also be called the pituitary fossa. It is such another beautiful thing. We covered that one during the study of what we call the nervous system. Okay? Now, when you come down here, just below the tongue, we have this beautiful structure. You know how we call this structure here? The whole of this structure, you know how this structure is called? This structure here is what we call the epiglottis. Okay, is what we call the epiglottis, and this structure is super very important. Whenever we are swallowing, it has to flap down and close what we call the larynx, such that food or air or what we call liquid should not enter into what we call the respiratory system. Okay, so now during swallowing process, this kind of epiglottis, it flaps down on top of what we call the larynx. Super very important. Okay, and then of course at the back here we have this bone. You know how this bone is called? This bone here is what we call the hyoid bone. Okay, what we call the hyoid bone is just going to be next to what we call the epiglottis. And then we have these ligaments. These ligaments are going to be linking this of the bone to what we call the thyroid cartilage. Okay, this is what we call the thyroid cartilage. And of course, the thyroid cartilage is going to be linked to the hyoid bone by this the ligament, which we call the thyroid ligament. Okay, and then of course we are going to be having what we call this structure here, what we call the vocal cords, or even what we call the vocal folds, having both the true and then also the folds. And then also have the center canal within the vocal cords. That center space, you know how that center space is called? That special space inside here, that kind of the tube area, that kind of the opening is what you call the glottis. Okay, this kind of the area is what we call the glottis. Okay. Then we also have what we call the arachnoid tissue here, which is just going to be next to what we call the vocal folds. Okay, this is such another beautiful thing. Okay. Then we also have what we call the cricoid cartilage. And then also here we have what we call the thyroid gland. Okay, this one here is going to be what we call the thyroid gland. Of course, the thyroid gland is going to be having two of them. We're going to be having another one here and even another one here, and they're going to be connected together by the structure which we call the isthmus. Okay, so now these are the main parts that really make what we call the oral cavity, and then some other structures which are going just to be next to it. You know how do we call this structure here? And this structure is going to be allowing the passage of air into the lungs. And how do we call this structure? This structure is what we call the trachea, or we may even simply call it the windpipe. Okay? And then at the back, we have this muscular structure. You have this muscular structure, super very important part of what we call the alimentary canal. You know how we call this structure here? The whole of this structure here is what we call the pharynx. Okay, you may find some other people calling it the throat. Okay, and this pharynx is going to be having three divisions. What are the three divisions of the pharynx? We have the first one on top, what we call the nasopharynx. This one which is in black, the nasopharynx. We have this one which is just going to be next to the oral cavity, just at the back, where food has to be touching. And this type of the pharynx is what we call the oropharynx. Okay, and then just below what we call the oropharynx is what we call the laryngopharynx. You may find some other people calling it the hypopharynx. Okay, meaning that the pharynx has three portions: the nasopharynx, the oropharynx, and then even what we call the laryngo or hypopharynx. Okay, and then just next to it down here we have this kind of the masticular tube, 25 centimeters, around 25 centimeters, that propels the food down to the stomach. You know how this tube is called? This tube is what we call the esophagus. Okay, is what we call the esophagus. So now, when food leaves what we call the oropharynx, it is now propelled down. We have a certain kind of the ring here. We have this a certain kind of the sphincter just on top of what we call the esophagus. You know how this kind of the sphincter is called? This kind of the sphincter is what we call the upper esophageal sphincter, and it is super sensitive to what we call foods and even any kind of the liquid. When anything like food or fluid touches this kind of the upper esophageal sphincter, it is made to relax and then to open such that food or liquid enters it, but it is not sensitive to what we call air. Okay, that's why when someone is breathing, air cannot enter into what we call the esophagus, because air does not have influence on the opening of the upper esophageal sphincter. Okay, so now once food has now passed through the upper esophageal sphincter, goes down, as it enters towards the stomach, as it reaches towards the stomach, we have another kind of a gate. You know how this gate is called? This gate down, as you enter, you slightly enter into what we call the stomach, is what we call the lower esophageal sphincter. There's another beautiful name that you can call it the cardiac sphincter. It is that which allows the food to enter into the stomach and then it closes. If it doesn't close, it will lead into what we call the flashback of food back into what we call the esophagus. And the food which is going to be leaving the stomach is going to be having too much of the acids, and of which the epithelium of what we call the esophagus may not be friendly with what we call the acidic medium of the food content coming back in what we call regurgitation. And of course, this one can predispose someone to what we call gastroesophageal reflux disease. And of course, if that one happens, you're going to be having what we call Barrett's esophagus, whereby even have what we call metaplasia, whereby the cells lining the esophagus tries to change to those cells that are going to be lining the stomach, because the cells lining the stomach, which we call the simple column, can handle the acidic medium of the stomach. That's why this kind of the cells lining the esophagus tries to change those kind of the cells lining the stomach such that they can handle the acidic medium. And that's what we call Barrett's esophagus. And this is going to be one of the predisposing factors of what we call the esophageal. Okay? It is such another beautiful thing. Okay, and then of course at the back you have to know in mind that this is going to be now where our spinal cord is going to be passing. Okay, you're going to be passing between this kind of the vertebral column. Super beautiful. Okay, so now having looked at the anatomy and all the structures of the oral cavity and other structures that are just next to it, let's go briefly and talk about what we call the tongue as one of the main accessory structure of the digestive system. Okay, so now this is going to be a simplified structure of the tongue, and this is going to be what we call the root. This is what we call the root. This is what we call the body of the tongue, and this is what we call the apex. Okay, what you call the apex, you may find some people calling it the tip. Okay, that's the brief anatomy of the tongue. Okay, so now talking about the regions of the tongue or the surfaces of the tongue, we have what we call the dorsum part and even also what we call the ventral surface. Now when we talk about the dorsum part, this is the area which is the top part. The top part of the tongue is what we call the dorsum part, and then the ventral side is what we call the downer one. Okay, the lower side of the tongue, which is going to be having what we call the lingofrenulum, which is also going to be having the opening of the sublingual salivary glands, the ducts, what you call the ducts of the venous, and even also some kind of the blood vessels are going to be what you call in the ventral side of the tongue. But when we come on the dorsum part, of the tongue, we are going to be finding a lot of structure. We have those kind of the tiny projections which are going to be located on the dorsum part of the tongue. You know how these tiny projections are called? These projections are what we call the lingual papillae. Okay, these projections are what we call the lingual papilla, and we have a couple of them. The following are examples of the what we call the lingual papillae. Okay, we have what we call the lingual papillae. Lingual papillae, and we have a couple of them. We have the first one as what we call the filiform. We have what we call the filiform. Okay, we have what we call the filiform. We have what we call the fungiform. Okay, we have what we call the fungiform. We also have what we call the valet. Okay, we have what we call the valet, but you may find some other people calling it the circumvalet. Okay, and then the last one we have what we call the follet. Okay, we have what we call the follet. So now these are the four lingual papillae that are going to be the tiny projections which are going to be on top of the tongue. Okay, and within this kind of the papillae, this is where you're going to be finding different types of the taste buds. Okay, you're going to be finding different types of the taste buds within this kind of these lingual papillae. However, not all of the lingual papillae are going to be containing the taste buds. Okay. Now, where do we find this kind of the lingual papillae? Generally, we are going to be finding this kind of the filiform. The filiform type of the lingual papillae are going to be the most tiny ones and the most numerous. Okay, the most tiny ones and the most numerous type of the lingual papillae. And these ones, they are going to be mainly located at the tip. Okay, they are just going to be located mainly at the tip of the tongue. They are just going to be more specially located at the tip of the tongue. Okay, that is for the case of what we call the filiform. And then when we talk of the fungiform, this kind of the papillae, they are going to be part of them are going to be on the tip, and even also some of them are going to be on the lateral side, but more especially on the anterior portion, meaning that this kind of the fungiform papillae are just going to be anterior but slightly laterally. Okay, slightly laterally. Okay, so now that is for the case of the fungiform papillae. Then when we talk about the valet or the circumvalet, these ones are going to be just in a V shape. Okay, they are just going to be the V shape, just especially at the back of the tongue. Okay, so now this is where you're going to be finding what we call the valet or the circumvalet, just in a V-shaped arrangement. And then when we talk about the follet, these follet are going to be made especially on the lateral sides of what we call the tongue, and made especially the posterior aspect, but on the lateral side. That's where you're going to be finding what we call the follet lingual papillae. Now, we need to know, do all these kind of the papillae have the taste buds? The answer is no. Some of them do not have the taste buds. Now, we have the filiform. I want to pay much attention on the filiform. The filiform has no taste buds. Okay, has no taste buds. We do not have taste buds within the filiform, but the rest of them, like the likes of the fungiform, the valet, and even also the follet, all of them, they have what we call the taste buds. Okay, they have what we call the taste buds. Okay. So now, this is the really simple anatomy of what we call the tongue, with the lingual papillae, the root, the body, the apex, and even also the taste buds. But now we need to first know, what are those kind of the tastes? What are those kind of the taste sensations that are going to be picked by what we call the tongue? Now, we need to look about what we call the taste sensations. Okay, what we call the taste sensation. The following are the category of the taste that can be picked up by the tongue. We have what we call the sweet. We have what we call salty. Okay, we have what we call salty. We have what we call sour. We have what we call bitter. Okay, we have what we call bitter. And even also there is another minor ones which many people call the savory, but can also be called the umami. Okay, which can also be called the umami. So now these are mainly 5 kind of the tastes that can be picked by what we call the tongue. Okay, and then of course at the back of your mind that the tongue are going to be having we have, for example, the anterior two thirds. Okay, we have what we call the anterior two thirds. Anterior two thirds, and then even at the back we have what we call the posterior. We have what we call the posterior a third. Okay, and of course the type of the sensation picked on the anterior third of the tongue is going to be picked by what we call the corn nerve number 7, which is what we call the facial nerve. And then for the case of what we call the posterior third, it's going to be picked by what we call corn nerve number 9, which we call the glossopharyngeal arch. And even also going to be having some little kind of the sensations of taste being picked at what we call the back of the oral cavity, just on what we call the pharynx, which is going to be part of what we call the vagus nerve, picking that kind of the sensations. Okay, it is also such another beautiful thing. Okay. So now, having looked at what we call the anatomy of the tongue, and then of course at the base of the tongue we're going to be having what we call the lingual tonsils, and even what we call the palatine tonsils. Okay. So now this briefly covers the tongue, and then of course when we talk about the functions of the tongue is a muscular organ that helps in what we call the swallowing process. It compresses the food with the hard palate. In that kind of the compression, it propels it back. Okay, the tongue has to appreciate a certain shape that's going to be making a certain kind of trough. Okay, so that the bolus which is formed is pushed at the back in the process of what we call the oral, what we call the swallowing process, which is going to be the back of face. Okay, the back of face, the tongue does a very, very, very important role in the process of what we call swallowing. It is also such another beautiful that you need to know. Okay. So now, having looked at that, let's briefly talk about something small about what we call the teeth. Now, the teeth is going to be one of the most hardest tissue in the body because it's going to be so much calcified. Okay, and it's going to be anchored in what we call the mandibles, both the upper and then even also the upper maxillary and then the lower mandible. Those are the structures that are going to be providing anchorage of this kind of the calcified tissues, which we are calling the teeth. We have a types of the teeth. We have what we call the primary teeth that are close around 20 of them, and even also have what we call the permanent teeth that goes up to around 32 of them. Okay. However, we have 4 categories of teeth. What are these 4 categories of teeth? We have the first one. We have what we call the incisors. Okay, we have what we call the incisors, and of course the incisors are going to be 8 in number. Okay, the incisors are going to be 8, in number. This is the anterior ones. Okay, the anteriors, and they are super very important in the process of cutting. Okay, they are helping so much in what we call the cutting process. Okay, and then the second type of what we call the teeth is what we call the canine. Okay, is what we call the canine, and of course the canine just slightly at the back, as you move off from what we call the incisors. The next pair which you go is what we call the incisors, is what we call the canine. And of course these ones, they are only 4. They are only 4 in number. Okay, and then the third category of the teeth. The third category of the teeth is what we call the premolars. Okay, what we call the premolars. And of course the premolars, they are going to be 8 in number. Okay, they are going to be 8. They are going to be 8 in number. And of course the premolars are super very important in the grinding process. Okay, grinding process. And then the last type of what we call the teeth is what we call the molars. Okay, is what we call the molars. And of course the molars are going to be the last ends at the back of the oral cavity. Super very important in the chewing process. Okay, it is these molars which are aids in what we call the chewing process, and they are 12 in number. Okay, they are 12 in number, and they do more specially what we call the crushing, the chewing process, the mechanical process of the chewing process in the oral cavity is going to be under the influence of what you call the molars. Super very important. So now if we add up together, we shall come up with what we call 32 teeth. Okay, we shall come up with what we call 32 teeth, and this is going to be one for what we call the permanent teeth for an adult. Okay, this is such another beautiful thing. So now incisors are going to be for cutting, then the canine are going to be mainly for tearing, the premolars are going to be mainly for grinding, and even also for molars are going to be more especially for crushing, chewing process, to make sure that food is chunked down before we make the bolus, and then it is swallowed down to the stomach for other processes of mechanical and then chemical digestion. This is such another beautiful thing. Okay. So now we're going to be now finalizing that by looking what we call the pharynx. And of course, we talked about the pharynx is going to be close to around 12 to 14 centimeters long. Okay, it is on which it transitions what we call the esophagus. So now, when we talk about the pharynx, when we talk about the pharynx, we have said that can also be called the throat. This structure is a muscular structure and is close to around 12 to 14 centimeters. Okay, and we have said that it has 3 divisions. What are the 3 divisions of what we call the pharynx? The first one on top is what we call the nasopharynx. The nasopharynx that is going to be aiding in what we call to make sure that food does not flow back into the oral cavity when this kind of the soft palate just clings on it. Okay, and then next to it at the back of the oral cavity, this is what we call the oropharynx. Okay, what we call the oropharynx. Okay, and then the last one down is what we call the laryngopharynx. But you may find some other people calling it the hypopharynx. Okay, the hypopharynx. Okay. Now we have this opening. You know how this opening is called? Just between what you call the uvula and even what you call the epiglottis. You know how this opening is called? This opening here is what we call the fauces. Okay, this opening here is what we call the fauces. Okay, what we call the fauces. Okay, what we call the fauces, the opening from the oral cavity down to what we call the oropharynx. It is also such another beautiful thing. Okay, so now this briefly covers the anatomy of what we call the oral cavity and even all other structures that